Okay, we'll make a start. So welcome everyone to this webinar. My name is Kerry Jones. I currently work as the Senior Nurse Lead for Retention at NHS England, but I was previously Magnet Programme Director and Pathway to Excellence Programme Director at Nottingham University Hospitals, who last year became successful in achieving their designations for both. I'm really happy to say. But we're here today to explore creating conditions to empower nurses, enabling them to lead care and services using the full extent of their expertise and ability so that they can drive improvement and change in care. And what's interesting about this and what the research actually supports is that when nurses are empowered, supported and enabled to deliver excellence in their job satisfaction improves and they're more likely to stay working in the profession. So when the World Health Organization estimates that there's currently a 5.9 million shortfall of nurses globally, this makes this a really relevant subject for all of us, no matter where we're from. We want to deliver excellence in care, don't we? But we also want nurses to remain in the profession and really to use our collaborative power. I mean, there's just under 28 million of us across the globe to improve health and healthcare across the world. So today we're going to hear about how some organisations have worked towards achieving this aim, creating the right environment for nurses to thrive, and not just thrive, but also excel. We're going to hear particularly about organisations' experience of the American Nurses Credentialing Centre Magnet Programme as a model for this. And of course, the ANCC have two distinct programmes in this area, but they have a complementary focus. Pathway to Excellence emphasises supportive or positive practice environments, including shared governance structures that value the voice and contribution of nurses in everyday decision making, and of course also on their well-being. And then Magnet recognises quality outcomes, patient care and nursing excellence, and also innovation in professional practice. But I suppose creating optimal workplace cultures and environments is key. So we'll be hearing from a range of panel members who will provide their views on how we harness the power of the nursing profession, how we can also improve in care. We've got limited time and there's a huge number of you joining. So unfortunately, we won't be able to have verbal questions today. So what I would ask you to do is do tell us where you're joining from and who you are in the chat, because it's always lovely to know what community we're sharing with. And then if you have any specific questions, either related to the presentations or to our panel members, if you could put those in the question and answer chat, and then we'll try and pick up as many of those as we can. And if we can't, the team will try and follow up with you after the event as best they can. So without further ado, it gives me absolutely great pleasure to introduce our first speaker for this session, which is Dr. Rhoda Ridulia. And she's Magnet Programme Director, as well as a dear friend and colleague and supporter of mine in my work. And she is from New York Presbyterian Weill Cornell Medical Center. Rhoda.
Thank you so much, Dr. Kerry Jones. And it is so exciting to be here having this important conversation on creating a culture of excellence and nursing retention. And thank you so much to Nursing Now, Nightingale Challenge, for having me here today. So for my brief talk today, I will be presenting on nurses demonstrating excellence and strategies in nurturing excellence, both from the leader perspective and the organizational perspective. When you come to our hospital and attend one of our professional shared governance council meetings or our nursing practice council meetings, our quality council, quality and safety council, or even our operations council meetings, where we have our unit council chairs from each unit meet every month. And these are meetings led by our nurses at the front line of care. You will hear them talk and discuss about length of stay, how to reduce urinary tract infection rates, or nurse-physician relationships, how to improve that relationship, or even increasing COVID vaccination rates. And if you hear and listen into those conversations, you would think they're running the whole hospital in a very good way. I'm saying that because nurses who thrive in a culture of excellence are nurses who are empowered. And that's what I wanted to share with you today as I share with you how to nurture nursing excellence. I am proud of our nurses. Here at New York Presbyterian, Weill Cornell, and nurses and all other nurses, of course, across the globe, who put patients first, who are committed to families, and who are committed to the community. And I'll share with you a success story. In one of our units, particularly our bone marrow transplant unit, where at some point there was a struggle with central line associated bloodstream infections. And of course, that it was something that the unit, the entire unit committed to change and improve. So one day, one of our clinical nurses went to her manager and asked, I think I want to do something because we already have this CLABSI bundle, that's a central line associated bloodstream infection. And I know that we already are changing linens every day. That's part of our procedure, but I wonder how compliant we are with that. And because she went to the literature, okay, see that thinking of a nurse who's really committed to care and was wondering whether patients in a bone marrow transplant unit where they have graft versus host disease and had undergone total body radiation, she knows as a clinician that they can have dry, flaky skin and wondered whether the dead skin cells can harbor bacteria and contribute to the development of CLABSI or contribute to the CLABSI infection rates, had conversations with their physicians. And you know what? She found some pieces of evidence, probably not as strong, but went on and pushed for making a trial. Guess what happened? She partnered with the linens department, making sure that they have supply of linens daily. 3 months after, their CLABSI rates improved and cut it by a third of like whatever infection rates they had at that time. 6 months after, it was cut down to 50%. I'm sharing with this success story because that's when I say when you nurture a culture of excellence, these are our nurses at the front line, at the bedside, really thinking through their commitment to give the best possible care to our patients. Another success story, we have our nurses committed to not only providing care when the patients and families are in front of them while they're in the hospital, but they're thinking of the whole spectrum of care. So we have our burn center, we have an amazing burn team, and they committed not only to care for our pediatric patients when they're at the hospital, but they put together this amazing burn re-entry program. It's an outreach program where our nurses and child life specialists and the entire team partner with the school where the pediatric patient who had burns go back to. Remember welcoming a classmate, like a child again back into the school, and now who may have had some damages and body image changes because of the burn. So first, our team goes to the school and prepare the class, whether it's an elementary school or a high school class, work with the teachers and prepare them that their classmate or their friend is coming back And every time I think about this, the amazing impact of how our nurses are thinking of not only when our patients are in front of them, but thinking through the whole continuum of care. Our nurses are able to do this because there is support, right? It doesn't happen just because they're committed. There needs to be commitment from the organization, commitment from every leader to nurture nursing excellence. And this is where the leader's perspective comes in. If I think of our vice president and chief nursing officer, whether my hospital here at Weill Cornell Medical Center or my other new campus at Gracie Square Hospital, communication, visibility, and accessibility as related, of course, to anchored within our magnet model of transformational leadership domain is aligned to. Communication, our chief nursing officers do conduct town halls, whether it is in person, this was pre-COVID, or being creative in virtual town halls. And during those town halls, our nurses, everyone, actually anyone from the nursing team, even our nursing support team, have the ability or the opportunity to ask a question. They can do the polling text feature and ask our chief nursing officer about any question under the sun, because that communication, that open communication needs to happen to nurture that culture of excellence. Monthly newsletter, or even quarterly, if that's what time would allow, right? Our chief nursing officer also co-chairs a staff advisory board where the chairs of each of our campus-wide nursing councils, we have our evidence-based practice research council, quality and patient safety council, like we have a recognition, retention, recruitment council, like all the chairs meet together every month to have that integrated communication system and platform and meet with our chief nursing officer. And of course, email. Visibility and accessibility. Cannot emphasize enough the importance of unit rounds. Our chief nursing officers, senior leaders, directors of nursing, doing unit rounds and speaking to the team and having this listening conversations. Fireside chats, this actually happened. This was right before we went totally virtual. We were trying to be creative in having smaller groups of town halls, and our chief nursing officer, whether it is a morning fireside chat or a night fireside chat, we made them happen in nurses' lounges. And it was really just this casual conversation, hearing about nurses' concerns, their aspirations, issues, and it's creating that safe space to speak and have that direct access to leadership. Shadowing. Our nurses have opportunity to shadow directly our leaders, our directors of nursing or our chief nursing officer herself. They'll be so thrilled to arrange that with appropriate structure and scheduling, of course. We have fellowship programs. We have an innovation fellowship. We have an academic research practice partnership with our Columbia School of Nursing. And now, of course, now most recently, we have our Innovation Fellowship just rebranded as a Chief Nurse Fellows, which is sponsored by our Chief Nursing Officer. And they have the opportunity to be mentored directly by her or any of our leaders. You'll also have breakfast with the CNO for our new hires. So really emphasizing the importance of the support of leadership through communication, visibility, and accessibility. And very important, and more than ever, we've really seen how important the advocacy piece is for leadership, for leaders. What is the role of leaders in advocating for resources? This looks so simple, right? Allowing bottled water at nurses' station, but we went through a phase where food and water were not allowed at our nurses' station. And during chief nurse rounds, our nurses would ask like, oh, can we just have bottled water? Is that allowed in the policy? So of course, our chief nurse would, take notes. And when that became like a recurrent issue, she took that back to our, it sounds so simple, right? But we have to make sure we have to check with our regulatory department, get regulatory leaders checking on the actual policy and requirement. And it was clarified that yes, for as long as it's covered, you can actually have that at the nurses station. And again, once again, committing to ensuring hydration and commitment to the well-being of our nurses amidst a busy shift. Next, one of the things that was picked up again during leadership rounds is dedicated medication room for chemotherapy. Once again, our nurses wanted a space where they can do independent double checks for chemotherapy in a quiet space, and asked our chief nursing officer if they can have a room where they can have that. With advocacy for resources, you know very well, leaders in the room, that doesn't happen overnight, but with persistence and appropriate communication, that happened, and it led to successful reduction of medication errors. That was actually one that we highlighted in our first designation document. Now, how about the organizational perspective? So all of this cannot happen without organizational support. And under the second domain of the magnet recognition program is commitment to professional development, right? It's structural empowerment, providing opportunities for tuition benefits so nurses can advance in their career. And true to our World Health Organization Nursing Now mission of elevating the status and profile of nurses around the globe. Certification, committing to financial support, whether it's partnership with certification bodies, exam prep through review support, preparing for the review, and recognizing that once nurses have been certified through the newsletter or within the unit or highlighting them on social media. And we also have what we call our amazing platform, where you can actually send e-cards to your peers or to anybody in the organization as a way to recognize that. We have our recruitment, retention, and recognition. It used to be R3, but our nurses wanted the fourth R, which is respect. Recruitment, retention, recognition, and respect committee or council. We have a day council and we have night council. And when you ask them, oh, we are the fun committee, because they organize our Daisy Awards, our Nurses Week celebrations. They do the Engagement Expo, where they bring all committees together to learn more about the opportunities. And as well as we have a subcommittee for community outreach led by our nurses, our clinical nurses. This is a picture that Dr. Kara Jones probably will recognize. When I speak about excellence, it always takes me back to my visit as well to Nottingham University Hospital in 2019, when I had the opportunity to see their complementary therapy and renewal center. And I'm reminded of this because this is organizational support and organizational commitment to wellness. This center is not only available to patients, but even to employees, nurses, and staff to get respite and renewal through complementary therapy. Nurturing nursing excellence also means commitment to patient safety and quality by everyone, and of course the organization. We have our HAI champions, this is composed of the interprofessional team, nurses aides, we have our quality specialists, physicians, and they are all working together, meeting monthly, really having that laser focus in improving HAIs. We have a quality cup, this big cup that goes from one unit to the other, that recognizes units who are performing or high performers in these areas, including patient experience. And there are other things here like Trach Thursday, and we have dashboards, which are all ways to really look at and commit to patient safety and quality. I'm getting close to the end, and this is new knowledge, innovation, and improvements. A culture of excellence also commits to sharing knowledge, including internal within the hospital and external dissemination of new research, evidence-based practice projects, and quality improvement projects that occur. And for us, we have our annual poster symposium. We've had a record of probably close to 70 posters. You would think you're in a conference here. This year it's different, it's virtual, but you would we do that to encourage sharing of knowledge and really having that continued scholarly innovation and improvements culture. Support for nurses who are presenting at local, national, and international conferences and publication. So I will wrap up here because I don't think that we have the time. We're running out of time, but in a nutshell, to nurture nursing excellence, if you ask any of us here, any of our leaders and our magnet leaders, the heart and core of culture of excellence is professional or shared governance, nurses having a voice, supported by transformational leaders, and really, of course, supported by strong organizational, organizational support. And that is my presentation. Thank you so much.
Thank you, Rhoda. That was really an excellent overview of all those important components to nurturing excellence and supporting nurses to be the very best they can be and deliver great outcomes. Thank you. I'm going to move us on because I'm just mindful of time. We're going to have two speakers now to talk about their experience of creating that optimal practice environment. And our first speaker is Dr. Tammy Casper, who is the magnet lead at Cincinnati Children's Hospital in the US.
Hello, everybody. Thank you so much for having me join in on this awesome forum and hearing from many experts across the globe. So I'm excited to share with you a few touch points that we have here at Cincinnati Children's regarding our nursing excellence history. And next slide, please. So for some of you who may not know Cincinnati Children's Hospital, this hospital began way long ago in 1883 in a 3-bedroom apartment where 3 nurses took care, or around 3 or 4 nurses took care of 10 patients. So when you think about that, that was 138 years ago that nurses were at the forefront in Cincinnati caring for a pediatric population of patients. Currently, when you fast forward those 138 years, we still have nurses at the forefront caring for our patients. We have expanded our services to include an inpatient psych specialty line. We have a second campus that has specialty services for cancer patients, labor and delivery services, and additionally, we have now building a critical care building that will be opening up in the next few months. However, across all that time, we have over 4,000 nurses at the front line caring for our patients. And with this expansion, nurses continue to assess, diagnose, plan, implement, and evaluate patient care at all levels. So when I heard the number, 28 million nurses across the globe, I felt like that 4,000 sounded pretty high until I heard the new number across the globe. So next slide. So the question posed to me as we were thinking about what would be relevant to share with you guys today was, why are we pursuing our 4th magnet redesignation? And the answer came to us fairly easily, and it is that we all believe that we need to continue to elevate our nursing professional practice and recognize the nursing excellence across our system. So when we do consider our programs are progressive, although when you compare and talk to other pediatric hospitals, it seems like we are comparable in our service lines and our care practices. However, Magnet really is the one organization that holds those standards up for comparison. We know those standards are updated every 4 years. We know those standards represent a positive work environment. And to be really transparent with you, our leadership is very intentional to secure the voices of the frontline staff in all of our improvement projects. Magnet does keep a pulse on the changing landscape of healthcare, and we know within the last few years, the explosion around advanced practice providers and ambulatory services is where we're headed in our future of nursing care. If you don't mind, just flip to the next slide, please. So I wanted to give you a few examples of how our nurses' voice are recognized in our organization. And these are just 3 examples. Please know I could go on for quite a while outlining examples of how we represent how our nurses inform the care that we have here for our pediatric patients. We have had a couple of versions, but our latest version for our shared governance program is what we call our interprofessional shared governance program. And this is a dyad model where we have a lead clinical RN and a lead allied health profession. And within that structure, we have a monthly form that's 8 hours long. And while the leads are working within their tenant councils, we know that that voice of interprofessional practice is what makes the difference. So I'll give you some examples of what our shared governance program has accomplished over the last few years. Some examples include the development and implementation of a preceptor award program, not just for nurses, but for nurses and our allied health professions as well. We also have a tenant council who's worked on improving the processes around ensuring our non-English speaking families are discharged with the correct language in hand as they leave our organization. We also have full steam ahead of CLABSI reduction and our aggressive patient injury reduction teams working to inform our leaders of what works well at the point of care and maybe where there's room for improvement. We have eliminated costs by standardizing our practices. Those are some other examples. And most recently, we have implemented some best evidence regarding the use of enteral tube placement verification by implementing gastric pH testing. So those are just a few examples of how our nurses continue to change our care model to improve the outcomes of the patients that we serve here. The second example I wanted to share with you is our Magnet Champions program. I'm actually meeting again with a group of leaders this afternoon. We are getting ready to relaunch our unit level Magnet Champions. And the full scope of this role would be to have those unit level champions to continue to embed the enculturation of the Magnet excellence practices. So we had this program in hand a while ago and it fell off because of other priorities, but we are revamping up to ensure that we're meeting the needs of our frontline staff. It's such a crucial role as we move forward. And then the last program I wanted to highlight, which has been in place for about 1.5 years, is we had rolled out a brand new clinical advancement program. And our clinical advancement program truly recognizes our top-notch clinical nurses. Our program now focuses on them submitting a story, a couple of stories that highlight a memorable event in their care environment. And it tends to be, it's usually around a patient care scenario. And they also submit a letter that outlines their leadership characteristics and their contributions. And it goes through a rigorous process. But I will tell you, I am a reader of the stories to stage their clinical practice. And I am in awe of what I read. I was reading stories yesterday, and I was just so touched at when I'm reading the stories, hearing what the nurses are thinking about as they're caring for their patients. They've really highlighting the whole patient in their stories, not just the problem that they come to the hospital for. So this clinical advancement program is reinforced by the levels of nurses education as well as their certification. but it's also a huge recognition to our clinical nurses who achieve their clinical advancement. And last round, I believe we had 46% of our nurses achieve clinical advancement. So that's a huge kudos in recognizing the nurses at the front line. So that's another example of how the nurse's voice is heard here at our organization. And Rhoda, I know you mentioned earlier about nurturing nurses. And so that really, I had to write that down when you opened up, and I think many of the stories that I read with the clinical advancement program that the nurses submit, just demonstrate not just the problem, but the whole patient. And I feel like the clinical advancement program does nurture those nurses in that forum. So I want to thank you for saying that. And those are my 3 examples that I'm sharing with you guys today. Hopefully that'll help plug in some thoughts and reasons as to why, Cincinnati Children's feels it's very important to continue on with advancing the profession of nursing.
Thank you, Tammy. That's such an inspirational story about, what creating that environment has done to deliver really great nursing for patients, and really, really motivating your nurses.
Yeah.
Sure.
I'm very proud of our nurses. I mean, it just is it just fills you. So thank you.
Wonderful. Thank you. And so I'm now going to go to Helen Robbins, who's an NHS Grampian in Scotland, and she's the Magnet lead there, and she's going to give us her story of what they've done in NHS Grampian.
Thanks, Kerry, very much for that. So I've just put a picture there to show where we are in the northeast of Scotland in the UK, and the area is known for its fishing and its mountains. If we go to the next slide, thank you. What I've done is put together some of our steps that we've taken to on our Magnet journey so far. And I'm going to talk through some of these, and then I'll come back to this slide at the end. Thank you. I think that leadership is really important to support you on your journey. And we were very lucky that we had leadership support right from the start. And we still have that leadership support. I think you don't perhaps need to have it at the beginning, but it certainly helps. But you definitely need it at some point in your journey. Thank you. I was lucky enough to be awarded a Florence Nightingale travel scholarship, and that allowed me to go to Australia to visit the 3 Magnet hospitals there and go on my fact-finding and start my fact-finding journey, really. I think that that's really important at the start. Thank you. And whilst there, I gained some wonderful friends and colleagues who I'm still in touch with today. And you'll see that Kerry's on the slide as well, because I built up relationships with UK colleagues, and I certainly encourage people to do that, because I've found that Magnet colleagues are hugely beneficial in sharing all sorts of things. And I've gained loads of resources and had lots of email exchanges asking different questions backwards and forwards, etc. Thank you. The other thing that going to Australia allowed me to do was actually see things in action. And I think I gather examples all the time because I think they're really powerful. I think it's really difficult for someone to argue and say something doesn't work when you can actually tell them, but I've seen something in practice. I've used this next slide because having done quite a bit of improvement work and in quality work, it's this bit around building the will that people underestimate, and that actually takes really quite a long time. And has probably taken us quite 2 or 3 years, really. Thank you. We redid our strategy, as you can see, back in 2018. And we used the principles of Magnet to structure our strategy, and the leadership around nursing and allied health professionals was really clear that they were happy to do that and wanted to do that. And we built within that the components around Magnet, and we developed it as a one-page strategy that was just spread all over the organisation and is really well known and referred to. Thank you. We also spent time, actually probably about a year, developing our professional practice model. And we had numerous workshops to do that. And as you can see, that there was pen and paper provided and people did sit and draw. And then we got those mocked up by graphics department. And then you'll see the voting picture there. We actually went out to the 6,000 odd staff and asked them to vote. And so the final model on the next slide, thank you, is really developed from the voice of the staff. And again, like the strategy, came out about the same sort of time. That is also spread across the organisation and is very well recognised today. And we've also built it into quite a few things that we've done since. Thank you. Including putting it on cake. When I went to Australia, they seemed to use a lot of pizza in their meetings. We seem to use quite a lot of cake. And this is at one of our launch events. Thank you. The next thing that we did as well was to develop our own recognition scheme, and we used our professional practice model. So we used the central part of it, and someone came up with the fact it might be orange, and then what the orange might stand for down there on the side, the recognition award for the MMAT Grampian Employee of the Month. Now, I must have spent about, I don't know, a year trying to persuade somebody to start giving out a reward to their staff. And there was a lot of hesitation and nervousness, etc. And eventually two enthusiasts and innovators that are known to be innovative for other things did actually start. They were really brave and they started it in their own work area. And that's another, I suppose, tip really is go to the enthusiasts and really work with them and just get them to start something for you. This is now well embedded across our organisation and goes down really well, as you'll see in the next slide. Lots of joyful occasions there. They're given a certificate, given gifts as well, and we put it all over Twitter, etc. And we try and get a senior member of staff to present it. Thank you. We also have developed other awards as well, and we have about 4 or 5 awards that happen now, and this is another one. And as you can see, we still like cake, but this is still referred to, this event pre-COVID 2019, that it was quite unusual to bring people together like this, all the people who had won different things, and really recognise and celebrate. Thank you. Another thing that we've done is set up a Celebrating Excellence event, and I think my colleague who helped set this up is on the call. We've now run our 12th event, and we took it online last year, and it's worked really well online as well. Face to face, we would have about 100 people. We would run it about 3-4 times a year. And you'll see across the bottom, it actually is used for multiple things. So one of the main reasons for setting it up was I wanted to flush out evidence so that when we do submit for Magnet, we've got a wealth of evidence that we can pull upon and examples. Staff are asked if they would like to, sorry, if you could go back. Staff are asked if they'd like to present posters or speak, and we've now got the next event full already, so it's gained momentum that people know that they can present their work here. Our shared governance councils always speak, and that's to try and promote the implementation and development of further councils because people are so enthused by them. We give out certificates. It's a good way for the director to meet with staff and to give out information about things like our strategy and our Magnet work that we're doing. So the director is very visible, lots of networking, and it's a good way to communicate and put out your brand. And we also now talk regularly about the reward schemes and educational opportunities. And just this last week, we were talking about how we could build in promoting more about research. So a really useful event. Thank you. these are just some of the comments that we've had about that event, that people have gone away really positive, lots of passion, really proud. They like all the teamwork. They're amazed at the shared governance. In fact, I would say the shared governance talks probably come out the best, often not a dry eye in the house. Notice all the enthusiasm, meeting people. Some of the comments there felt like they've made friends, felt very welcomed, really good as well to see good work acknowledged, etc. So very useful. Thank you. This is just one of our shared governance councils, and we were blown away by this group. They presented fairly recently. They all seem to come up with quirky names. As you can see, it comes out of our strategy, the empowerment of staff through shared decision making. And this council, this was just some of the things that they'd achieved. A welcome to theatre booklet, a buddying system for staff, a suggestion box, and then they'd also acquired hats with their names on to be able to know each other a lot better. And this then really spread to our other theatres work, which was really helpful. Thank you. One of my other pieces of advice is that there are people who will say, yes, but isn't it such and such, it's just for nurses, it's whatever. So we tried to tackle some of these issues really head on. And again, you'll see that Kerry is in the slide there, and we invited Kerry and Mandy from Nottingham to come up and speak to a large group of staff. And there was definitely, I can think of one person who was very skeptical that was in the room. But at the end of the day, after she could actually see that her colleagues and staff from the area were so enthused that she's now become one of our great advocates. Next slide. I also use lots of data, and one bit I think's dropped off the presentation there, but basically collected data from all sorts of areas that show that you can change your staff culture, and people can't really argue with data if you can show them that. So that's really useful. Next slide. Thank you. Just last year, we launched our magnet work, and we had that logo Magnetic North designed for us, and a video there from our nurse director. So that was a nice event to actually launch our journey. Thank you. And we also set up our champions group, and we went out to vote. So lots of staff involvement here, went out to vote to the group as to what name they wanted to come up with. Thank you. And they came up with that they wanted to be called Magneteers. And we asked them to do some posters around what magnet means to us. And this is just a selection of them. And we, again, were blown away by the vivid variety of the posters and how well they'd really grasped some of the aspects of magnet. Thank you. Finally, we also managed to go to the conference in Orlando in 2019, and we managed to take 10 people with us, had lots of great fun, but that really helped to cement with quite a few people that we wanted to get Scotland on the magnet map in the future. So it was very powerful taking people to the magnet conference. Thank you. And that's finally our magnet journey, some of the aspects of it to date, talking through the different parts of it. And I wanted to finish by saying, make sure that you celebrate along the way. Thank you.
Thank you, Helen. And oh, that was just a joy. I can remember you at the start of your journey, and just to see how far you've come and the difference it's making is just incredible. So congratulations.
Thank you.
It's a wonderful story, and some really practical tips for those that are on the journey or considering that journey. Really helpful. Thank you. So we've got about 15 minutes left, and in those 15 minutes, we've got an excellent panel of experts in their own right. And what we're going to do is ask those panel members to give a 2-minute statement, really, from their perspective. In relation to how we can harness the power of the nursing profession, improve retention and ensure excellence in care. What I'd ask you to do during this session is, if you have questions for the panel or any of our speakers, could you put them in the Q&A box? And then at the end of, when our panel have all sort of made their statements, we'll be able to try and work through some of those with the time we've got left. And if we need to go a couple of minutes over, maybe we'll eat into a little bit of extra time, depending on the Q&As. So I'm going to ask each of our panelists to introduce themselves and give their statement in turn. So I'm going to ask Professor Lisa Bayliss-Pratt, who's Programme Director of the Nightingale Challenge, to kick us off.
Thank you, and thanks so much to those brilliant speakers. It was just so uplifting, especially given the last sort of year or so that we've had with the pandemic, to hear the power and the passion for investing and really raising the profile and opportunities for nurses. So really delighted to hear all of that. I think one of the things that I'm left wondering is how well received is this with our medical colleagues, you know, where you've been able to raise the bar and show the power of the nursing voice. Has it strengthened into professional education and team working?
So do one of our speakers who've got experience of this want to respond in relation to that? Rhoda, I can see you peering. Would you like to talk about how you've worked with your medical colleagues, you know, in terms of that collaborative approach?
Oh, absolutely. We are proud of the many collaborations with our physician partners, whether it is in education, partnership in, just for example, in our simulation lab, even, you know, through prep with COVID and a lot of other things, research partnerships, our nurses being co-investigators along with our physicians. Brilliant. And really just doing mind-blowing innovative work to improve care and many other things, improving, like making practice changes from day to day, reviewing policies and procedures together, and conversations during interdisciplinary rounds. And I think I can go on, but we really have an amazing RN to physician relationship, which is so important in nurturing that culture of excellence.
And in some ways, Rhoda, do you find that they're almost envious of the culture that the nurses have created because of, you know, high quality collegiate working is everything, isn't it? And we don't see enough of it in health. We give a lot to our patients, but we don't give a lot to each other sometimes. And I just wonder if there's any envy of monsters amongst other professions when they see the nursing team sort of empowered and gelling so well.
Well, we are definitely proud of our, you know, culture of nursing excellence. And as you say that, Lisa, I'm reminded of our site visit during our initial designation, and actually flipped that with them being so proud. So there's a session for physicians, and they are asked by, you know, by the panel of our appraisers about nursing and how they connect with nursing. And you will hear testaments from, like, you know, chiefs of departments saying, I am who I am, and I practice, you know, at this level, and I do excellence because of our nurses, and I cannot do my job without our nurses. You would be in tears listening to their testimonies. And I think that really speaks about the strong collaborative culture that we have. And maybe they're a little bit envious too of our especially our cheerleading, cake, and the good stuff, right?
Brilliant. Oh, thank you for
Rhoda,
that.
I wanted to jump in because we have something very similar here at Cincinnati Children's as well. So we have our operational excellence program, where we have all our clinical nursing directors and AVP nurse leaders aligned with a physician, doing the improvement works and creating the strategic priorities for their own care areas. And so we do have a similar dyad model. And we also have the same thing with all our hack work. So for our CLABSI works, we have the physician nurse leads. So they're always in tandem with one another. And I think, you know, anybody who's looking at improving, we know it's a team approach. So, you can't do one without the other. So I echo very much what Rhoda said, and you know, it just can't be done in isolation. So thank you for bringing that up.
Thank you.
Or I just wanted to quickly add, we just had our Physician of the Year awards, and there's many other awards of Physician of the Year, but the one that's being given by nursing with the Physician of the Year awards is a most coveted award, because they said if it's coming from nursing, being recognized by nurses, it must be the top award. So just saying.
Wow, that is amazing.
Wonderful. And at that, I'm going to move on to Rebecca. Rebecca, I'll let you introduce yourself and tell us, you know, your thoughts.
Sure. Good afternoon, good morning. I'm so excited to be here, and I know we have tight time. So I'm Rebecca Greystone. I am honored to represent through the American Nurses Credentialing Center. I'm the Vice President of Magnet Recognition and the Pathway to Excellence program, and it's just so great to be with my colleagues around the world today. Carrie, I'm just going to abbreviate my 2-minute statement and just say I really can't improve upon what Helen, Rhoda, Tammy have said. Everything that they mentioned, and I love the fact that they got right into tactics and things that are happening and can happen within healthcare organizations. And you're hearing from colleagues that are at all stages of this journey of excellence, whether it's Magnet, Pathway, or some other recognition. I'm so thrilled to hear Helen. She and I go back many years, and I remember the beginning of the journey when she and I first spoke about, well, kind of what is Magnet and what does this mean, and our discussions around transformation. I would say really just four key takeaways that I heard today. The first one is belief. Believe in yourselves, believe in your organizations, and believe what transformation can happen. Secondly, you've heard this repeatedly, and we did not collaborate, by the way. We didn't see each other's presentations. So this is all just natural, organic, but it's empowerment, the power of empowering your teams and the transformation that can occur. Thirdly, communication, the importance of open, transparent communication. Any recognition program is not going to just turn every organization into some utopia. It is hard work. It is constant caring, feeding, watering, and nurturing of change. And lastly, I would say recognition, which is really the gold prize, the brass ring. Magnet and Pathway to Excellence are voluntary. You don't have to apply for these, but there is no organization, no matter what country you're in, what size you are, the level of resources, there are no limitations to applying for either of those programs to receive that international, the highest recognition the entire healthcare organization can receive. It's built on nursing and nursing excellence, but it's a recognition for all care providers. So Carrie, that's really quickly all I want to say. I think I did take 2 minutes, but I'm just so impressed by everybody and so excited to hear about the journey.
Thank you, Rebecca. Elizabeth, I think we'll bring you in next. Introduce yourself and let us know your perspective.
Good afternoon, good evening, everyone, depending on where you are. Thank you, Chair Carrie, and the invitation to speak today. I'm Elizabeth Pearson, a founding chair for the National Healthcare Conferences Uganda, the knowledge sharing platform for nurses and midwives, and interim president for the Uganda Nurses and Midwives Association, UK. Just to share some statistics first, nurses hold almost 25% of global health decision-making positions, and yet make up 70% of worldwide health workforce. Only 23% of World Health Assembly delegates are female-led, and yet we women are experts in our health systems, as Helena shared, and we have diverse perspectives. And nursing is still predominantly female. So to answer the question, I have 3 areas. I believe that if we adopt innovative ways to empower nurses, like Rebecca has said, with the knowledge, the right skills, the competences, and give them the appropriate tools, we will have improved retention rates and achieve excellence care like the Magnet has shown. But although nursing is one of the most trusted professions in the world, we are seeing in the pandemic, we are essential workers. However, we still struggle to convey the contribution we make to improving the nation's health well-being. So this causes a continuous struggle to attract enough people to consider it as a career. So historically, nursing has been taught in hospitals compared to other professions like engineering, but now it is taught in institutes of higher learning. So the nursing salary and pay scales should be commensurate with the different professional roles to create an attractive and worthwhile profession for the new generation. And lastly, I think we need structured mentoring programs where our leaders who have gained lifelong experiences can share with the next 21st century leaders like myself in a compassionate and professional space. I want to thank Bardet Trust of Nursing for this innovation of raising the profile of nurses globally. It has given us a voice and has created opportunities for innovative nurse-led projects like the Magnet. Watch out for Magnet UG. So much support is required for these programs. Thank you very much, Kerry.
Oh, that's what a wonderful contribution, Elizabeth. And you know, and that's what this is all about. It's about that global collaboration, how we come together in one professional voice to ensure that we have that influence and ability to improve health and healthcare. Thank you.
Thank you.
So it's Charlotte next. Charlotte.
Hello, I'm Charlotte Jacopoul. I'm a Safe Care Specialist Nurse and Chief Nurse Fellow at Gloucester Hospitals, England, UK. I'm also the Vice Chair of our Nursing and Midwifery Excellence Council here, so I'm really proud we've just started our journey. It's kind of hard to follow Elizabeth there, so I think I got the short straw here actually. So I think how can we harness the power of nursing profession? So for me, there's a few things here. So the most important thing in this aspect for me is self-belief and self-value. And I think the first step in moving forward from that is acknowledging that we're not good at that. We're not very good at it. And things like the phrase, I'm just a nurse, kind of come to mind actually. And to me, it's about that uniting. It's about that global identity, building stronger awareness of our skills, of our talents. And I think, you know, that will aid us in our self-growth, in the belief of our own value. And I think particularly nurturing early career nurses, as Elizabeth already mentioned there, from the offset, I think it's vital. And actually that will help us embed a new culture and a way for change. We have to be able to demonstrate that will to change and also work through that uncomfortable of essentially flattening sort of traditional hierarchy. And I think we need to provide a safe space for growth and shared decision making and taking risks. And I think that works across all roles. You know, it's not just nursing, it's actually the wider MDT, as we've talked about already of many of the presentations here. And I think investing into our colleagues, we really need to remember this, that investing into our colleagues, their voice, their ideas, their innovation, their own success, it's actually an investment back into our profession and into our own global health systems. It's a collective. And I think the truth is that, you know, staff don't leave for no reason. They leave because their fundamental needs aren't being met. And we've talked about how that can happen through celebration, through recognition, through hearing what people are saying and taking everybody at the table as a valued place. And I think, you know, we should approach it holistically, just as we do with our patients. We should bring it back to staff. It's been said, you know, we don't focus on what staff need, but actually ultimately it's full circle. And by doing this, we create better retention and actually ultimately create better environments to ensure excellence in our care.
Never a truer word. We are masters of our own destiny, aren't we? And, you know, we need to look after each other, nurture and grow each other. And I think, you know, what we do know is to deliver really great care for patients, nurses have to be cared for themselves. Thanks, Charlotte. And I'm now going to go to Romney. Hi, Romney. think you're on mute, Rodney.
Okay. So hi everyone. So I am Romney Aguilar from the Philippines. I am presently the acting chief nurse and the infection control officer of the government hospital, and I am presently the chair of the Committee on Public Relations and Advocacies of the National Nursing Association of the Philippines. How can we harness the power of nursing profession, improve retention, and ensure excellence in care? I believe that employers have a significant role in leading a healthy working environment for nurses to increase nurse retention and improve quality of care. Here in the Philippines, we have a continuous nursing shortage that is worsened by external migration of nurses searching for better working conditions and pay. Although the reasons for the current nursing crisis varied across countries, evidence shows that unhealthy working environment is one of the factors. This unhealthy environment affects nurses' physical and psychological health, such as the reasons for the stress because of the increasing working loads, such as in this pandemic, longer hours of duties, complex relations in the working places, and variety of working hazards. These reasons can affect nurses' personal relationships, increase sickness, conflict, dissatisfaction, and turnover. So I believe that employers should realize that they should create a positive change in the work environment to improve employees' retention rate. Cultural changes that enhance communication and collaboration, actively involving nurses in organizational and clinical decision making, professional development, leadership support, and implementing fair compensation are some of the approaches we can consider to implement that will promote a positive working environment. Let us all remember that the overall purpose of improving work environment is to enhance patient care delivery and improve the retention of our nurses. This leads to the better teamwork in the organization as a whole and increased continuity of care, and eventually that will lead to improved patient outcomes. Thank you.
Thank you. And just summarize that beautifully, far better than I could summarize the whole discussion across the panel. I'm very mindful of time. Lisa and colleagues, I think we absolutely need to carry on this conversation because this has sparked a lot of energy I can see in the chat and enthusiasm, and I think there's at least another hour's worth of conversation here, but mindful of people having commitments. I think what's been demonstrated here today is there's an evidence base, and the evidence base is telling us that excellence in care is about three things. It's about excellence in clinical outcomes, patient experience, but as importantly, staff experience. And we have to come together as a community and ensure that at a national level, a policy level, and also at an organisational level, care and nurturing of our nurses to ensure that they get great job satisfaction and deliver to the vast extent of their ability is supported and enabled. So at that, I'm going to draw us sadly to a close. Do feel free to make contact with each other if you've now got people's email addresses, and I can see in the chat there's some connections being made. And thank you to the Nursing Now team for facilitating this, and to the Burdett Trust for supporting. Good afternoon, morning, evening, wherever you are in the world, because I know we've got a global audience. Thank you, everyone. Bye-bye.